9th, 2021. I'd like to call to order a regular meeting of the Wausau Board of Education. Ms. Peck, would you do the roll call vote, please?
Jim Boucher.
Here.
John Kreischer.
Here.
Kyle Lowe. Here. Pat McKee.
Here.
Cody Nicolai.
Here.
Jane Roosh. Here. Lance Trollope.
Here.
Karen Vandenberg. Here. Lee Webster.
Okay. Everyone would rise for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. And number 4, our district mission statement. It is the mission of the Wausau School District to advance student learning, achievement, and success. Item 5. Mr. Nicolai, could you see if there's anyone signed up for public comment, please? I believe there is.
Yes, we have 3 people.
Wonderful. Thank you, sir. All right, we do have 3 individuals signed up for public speaking tonight. You've all been afforded a copy of our public comment policy, 0167.3. As stated in the policy, before your comments, please state your name and address. You will have 3 minutes for your comments, and Clerk Peck will keep you apprised of how much time you have left. Just as a reminder, speakers will direct comments to the board, not to staff or other participants. Any comments identifying specific personnel or students by name or through the use of sufficiently detailed descriptions so as to identify an individual are not appropriate subjects for presentation to the board and should be referred to the superintendent's office. Comments will be rejected if the content is reasonably interpreted to constitute discriminatory or harassing statements on the basis of any protected classification. Okay, with that, our first speaker, Bart Hobson.
Please, yes.
Is this on? My name is Bart Hobson. My address is 830 Franklin Street in Wausau. I'm here as the father of 3 boys, all of who have been in the Wausau School District. I have one who's going to be a senior this year. The other 2 have graduated. 2 of my sons had to spend last year virtual learning at home, as did all the students. So I'm well aware of the impact that's had on students. I'm here to request that the school board do everything possible to keep our children safe when school opens up this fall. Clearly there's been an unfortunate turn of events with the Delta variant of COVID-19 and the increase in cases. The latest word from the Marathon County Health Department indicates we had 153 cases the week ending August 6th. That's an increase of 5 times over what it was the week previous. And we don't know when that's going to peak or when it's going to come down again. Part of my interest in this, in addition to being a parent, is I'm a physician with over 40 years of experience dealing with infectious disease. And I know from my experience that there is such a thing as second week of school syndrome, which we would see in family practice and urgent care, as well as in the emergency room, and that is about the time the second week of school got started, a whole bunch of really sick kids would show up with upper respiratory infections. It's inevitable. They have colds, they have strep, and now they can have COVID-19. The only way we'll know if they have COVID-19 is to test them, all right? We did find out, of course, when no kids were in school, that there was very little transmission of upper respiratory infections among students. Also, the work done down in Wisconsin Rapids indicated that when kids all wore masks, there was greatly reduced transmission of upper respiratory tract infections, including COVID-19. So among the major recommendations that have been made by the Department of Health is that all students wear masks whether they've been vaccinated or not. My kids have been vaccinated, and I understand that kids under the age of 12 can't be, so that's a particularly vulnerable population, and we're seeing more and more serious illness among those kids. I can't speak to ventilation, which is another factor. I think cohorting is a good idea. I think it's going to be traumatic for kids to be sent home from school, which they'll have to be. We aren't probably going to allow more kids with runny noses and cough to stay in school because they could have COVID-19. So they're going to be going home. That's going to disrupt their families. The family disruption of having a kid come home unexpectedly or having to stay home unexpectedly, I think, will be greater even than the disruption when we told all kids they had to stay home all the time, because parents will be unable to predict when they'll be able to work and when they won't be able to work. Again, I think masking is the biggest issue that will help prevent that, and I certainly hope that we institute that as a policy. Thank you very much.
Thank you, Mr. Hobson. Our next speaker, Jay Coldwell.
I'm smiling. So good evening. I'm Jay Coldwell, 3422 Horseshoe Spring Road in Wausau. I'm the bumpa for 2 grade school kids. And I'm speaking on the same subject, maybe a little bit more from a philosophical point of view. We all live in community, and actions taken by individuals in community affect everyone. We're all connected. None of us is an island unto ourselves. We're all responsible to do what we can do to contribute to the health and vitality of our community. This regard for one another and care for one another is a foundation of living in civilization. Civilized society builds trust so we can interact with one another, provide for our basic needs, sleep soundly at night, look at ourselves in the mirror in the morning. So public health is a community activity. We treat our sewage, we treat our drinking water, we regulate dangerous behavior. Individual rights are granted in a civilized society within the scope of public health. Our private health decisions can be made in the context of public health. We have the right to make decisions for ourselves so long as they're not in conflict with public health. For example, our city drinking water contains chlorine to make it safe to drink. Without chlorinated water, we'd be at risk for many waterborne diseases. In a civilized society, you may not decide that everyone in the school has to drink the unpurified water from the rain barrel, which may contain waterborne diseases that may cause illness or death. That'd be against public health policy. And just so, our public health authorities and medical community have advised that during this phase of the pandemic, right now, school children should attend school wearing masks for the sake of public health. In a civilized society, we do not have the right to decide that our school kids should breathe air that likely has airborne disease that will make them ill or develop long COVID, maybe be hospitalized, maybe die. Individual behavior has to fit within public health guidelines. Many organizations in the state have decided to follow this current public health policy, including UW campuses, major employers and retailers, even Menards. So this is a way to maintain the best possible level of educational opportunity and commercial activity in our society at this phase of the pandemic. So as school convenes this fall, I'm asking you to please set a policy that's supportive of public health, of community and civilized society so that we can trust one another, sleep well at night, and look ourselves in the mirror in the morning. Thanks.
Thank you, Jay. And our final speaker tonight, Kate Ruling.
Hello, I'm Kate Ruling. As most of you know, I'm a family physician, and I have kids in the school district and still have a lot of contact with many kids in the district. I did not know Dr. Hobson was going to be here today, so I'll first just ditto that and I'll take a different angle, I guess. So again, I agree with all the information. I think one of the things we need to be looking at, and those of us who work for places that follow the science, which is the vast majority of people here. One of the scariest things about the current Delta variant, which is what we're worried about. I'm wearing this. I have COVID. I have long COVID. I've been vaccinated. But if I'm around a lot of people who haven't been, they're the ones with the Delta variant who are going to give it to me and increase me as a mildly immune compromised person. But what's really scary, I know last year many of the people who were very, very vocal at meetings were saying, well, the kids aren't getting it, the kids aren't getting it. That's not true, the kids are getting it. And if you look in all the states, especially the states with the lowest vaccination rate, you are seeing those ICUs filled to the brim. The children's hospital ICUs are filled to the brim. As far as our own local facility here, they've had to reopen the COVID ICU again. They have COVID units. They've had to restart doing everything again. And we're only at the beginning of our incline, Wood County being the highest of all our area counties right now in terms of the cases, which are primarily the Delta variant. And the thing we don't know is people say, oh, but the kids just get sick. It's like a cold. And that's not necessarily true, that it's not just like a cold, because some people get minimally sick, but some are going to die, and even kids who you think aren't going to die. And the kids who might have long COVID, my lung function's still a quarter down. I had it in October. I can't do the things I used to do. I improved with the vaccine, fortunately. I got some improvement. I can't do a lot of the same things I used to do. We're going to have a lot of people, we don't know how many because it's a new virus, but we know this is going to be something that will continue, and it's going to cause long-term problems. And I think it'd be really irresponsible, especially when we know the science, to say we don't need to mask, we don't need to take precautions. And in fact, last year, those who were most vocal about reopening the schools implied that they would do anything just to open the schools. Well, I want our kids to go to school. Everyone wants their kids to go to school. But we need to mask, we need to take precautions, we need to be smart people. So, thank you.
Thank you, Ms. Grogan. All right. Moving on to agenda item number 6, the consent agenda. This is an action item, and it includes appointments, separations, leaves of absence, retirements, minutes from the regular session of July 12th, 2021, as well as the special session of July 12th, 2021, donations to the district, including the Workplace Volunteer Council and Catherine Schneider, which we are very grateful for. So I would seek a motion to approve the consent agenda, again with great gratitude for donations to the district.
So moved.
Second.
We have a first and a second. All those in favor?
Aye.
Opposed? Motion carries. All right, item number 7, old recurring business. We have none. So we can get to item number 8, new business. Whole child, whole Wausau, short cycle report on service.
Good afternoon, board members. Thank you for the opportunity to give you an update on the service strand of the Whole Child, Whole Wausau strategic plan. So there are 3 areas under the service strand, the first being marketing. So I'll just start by reminding you of the goal, and that is to increase awareness and positive perceptions of the district as measured by an annual increase of 5% in Facebook fans and followers and an annual increase of 5% in positive media stories. So when we talk about Facebook, we have met that goal. In fact, we saw an 11% increase if we look at July 1 of 2019 through June 30 of 2020, and then again July 1 of 2020 through June 30 of this year. When we look at positive media stories, we also met that goal and then some. In fact, we saw a 14% increase if we compare over that same time frame. I'd also like to point out the fact that we did see a pretty significant increase in negative media stories to the tune of 400%. If we move on to the second area of the service strand, that looks at our programs and offerings. And the goal there is to increase awareness of district programs and offerings and optimize experiences for students, families, staff, and the community, as measured by a brief feedback tool with a baseline determined by June of 2020. Much like a lot of things, the pandemic derailed our plans for that. However, we are working toward that goal as we speak. There are a few options that we're looking at when we talk about a feedback tool. Two ideas are QR codes, which would allow for some pretty real-time data. That could be anything from concerts and other events to parent-teacher conferences. Really, we could utilize that however we wanted to make sure that we're getting the most important feedback on how we can just really optimize experiences for our stakeholders and our students as well. And then certainly with our new website, which I'll talk about in just a bit, there's opportunities there as well for us to put surveys to get real-time data too as well. So speaking of the new website, we're pretty excited that that launched in June. One of the things that the communications department and myself really wanted to do was make it just an easier tool to use all around for our parents and our students and our staff, but then certainly for the community too. Not only so that it's easier to navigate on the front end of things, but easier on the back end. And then, of course, a great marketing tool as well. We can highlight videos and some of the neat things that are happening in the district. So we're pretty excited about that. So if we look at the third area, the focus is partnerships. And again, the goal there is to attract and strengthen partnerships and optimize their mutual value as measured by quantitative and qualitative feedback at the conclusion of the partnership, or at least on an annual basis. And again, with the pandemic, that kind of derailed our plans a little bit, but certainly we are in the process of working toward that goal as we speak, determining the best feedback tool. And one area that we're really looking at is partnering with WIPS, which is the Wisconsin Institute for Public Policy and Service. They would allow us to do things like surveys, but then focus groups as well, to really make sure that we're getting the feedback that we need, but then that our partnerships get the feedback they need, and to see how we can better that partnership and work together there. And I also need to point out too that we have a lot of partnerships that are going great right now. YMCA, Boys and Girls Club, Police and Fire, just a few areas to highlight. So that's kind of an overview. I'm happy to answer any questions you have or take a look at some challenges and next steps. But yeah, I'll answer any questions you have at this time.
I'd just like to make one comment about the WIPS. I think it's a great opportunity to be joining up with them.
Mm-hmm.
They do a tremendous job in being a third-person survey group. I just got to do a shout-out for them and say that, you know, they definitely are very objective in how they approach things. And so working with them in the past couple of years, good choice.
And that would be just a great way for us to remove the biases, to get exactly the information we need so that we can better those experiences for everyone involved. Thank you.
Diane, I do have one question. First of all, congratulations on all the positive improvements. That's fantastic. On the negative side, 400% increase. Have we done, or could we do, some type of a content analysis in terms of what are the sources, like the top sources of the negative, the top authors and subject?
Yeah.
I would be interested in seeing that to see if there's correlation between where the negativity is coming from, and is it a certain group, if you will, or a couple
Or a certain topic.
Right.
If one topic is responsible for almost all of that, that's one thing. If it's 20 different things, that's different.
Right. Exactly. And that's why I think that topic, author, and publication would be
And we actually keep a spreadsheet of that, so I mean, we have it available at our fingertips. We can look at exactly what it is, and we can narrow down the topics and such.
Okay.
That
could
would be
you? I'm just thinking like the top 5.
Yeah.
Whatever it is, if you could share that with the board.
Yes, I can definitely do that.
Because it's interesting, you know, obviously we know that we had challenges last year with the pandemic, but a 400% increase of negative topics on a school district is troubling on a few reasons for me. Well, I mean, one, just kind of the human aspect of it. Publishing a 400% increase of negative stories is not helping the school district. So anything that we can do to turn that tide,
Yes.
obviously would be beneficial.
Yep. I can pull that data for you
Okay.
and send it.
Thank you very
You're
much.
very welcome.
Diane, what was the percentage of negative stories before that?
It was, if we look at, so this would have been July 1 of 2019 through June 30 of 2020, and then we look to the next year, and if we compare, it was only about 5%. So there was quite a significant
Right,
jump.
so there was probably a topic shift during those years.
Yes.
And also, I had a question about Facebook.
Yeah.
Does the percentage of increase, does that include clicks as well?
Does not include clicks. This would just, the insights just look at your followers and your likes. Now, followers are always better than likes. Likes, you just essentially attach your name to the page, but followers allows those who choose to do that, they will get all the information we post. So followers are always, and we're close to about 7,000 followers at this point.
Okay.
All right.
Oh,
Thank you.
sorry.
Sorry, Kai. No, go ahead.
Yeah. So speaking of WIPs as well, I like WIPs. I mean, they're research organization for the UW. You know, I worked for them as an intern after college or during college. So I'm thinking, you know, if the board would want to, maybe we can work with WIPs to partner with them for vaccinations with H2N. They're an organization that's working within WIPs, and they communicate to the community about the positives of vaccination. I mean, they were present at Hmong Festival, and so I actually went and spoke to the National Guard that was there, and they said that on Saturday they got 10 vaccinations, 1 on Sunday, and I asked them, you know, is that a good number? And they said, yeah, that's a really good number, and that was surprising to me that 11 people getting vaccinated at Hmong Festival was a good number. So, they were working with the National Guard as well. And so the National Guard, they were giving the vaccinations, and then H2N was just giving out the information. So maybe that's a conversation that we want to have as a board.
It's good to know. Thank you.
Anything else? Anyone? All right.
Thank you
Thank
so
you
much.
very much. Okay, next on the agenda, Mr. Uding is going to give us an update on enrollment.
Good evening, everyone, and thank you for the opportunity. It's really intended just to be a quick and a brief overall review of where we're at right now. And a couple important things to keep in mind with these numbers are they're ever changing. So you've got from August 4th in front of you. They are changing constantly. Just from noon till now, we've had 7 new enrollments come in online. So there were 4 this morning. So the numbers are very fluid at this point, to put it that way. So the other thing, as we look at these numbers, they are based upon where we ended the year on May 20th. It's not based upon our demographic account. I wanted to see where were we at the end of the year, last year when we ended, and where are we now and where are we headed with that. And you might be thinking, why May 20th? That's one of the last dates we had all the seniors in. So we were able to count them. Once they graduate, they come out at Infinite Campus and our student information system. So the comparisons are to May 20th, and at that point we're at 7,720 students, which was about 20 students down from where we started the school year overall with that. So overall we were pretty static throughout the year from where we started to where we ended. Overall the news is really very good. You have it all right there in front of you. Overall, we're up about 288 students, or we were, back on August 4th. The important part to know about that 288, it does include some partial enrollments in WAVE. We have 35 students from either within our district or the parochial sites that take additional sites. So that 35 is in there. So even if you take that out, we're at still 253 or somewhere around there off of those numbers. So a big increase for us as a district. Elementary is up. Middle school is down by 13 students. So basically flat. But when I looked into those numbers, we had a big outgoing 8th grade class and a much smaller incoming 6th grade group. So there was automatically a difference of about 80 students right there with that. So they're pretty flat. High school is up. Our charter school enrollment is down by 52 students. A big chunk of that is our elementary wave students. I think as we came back face to face, a large portion of those parents who had potentially chosen wave as an elementary option have opted back in. So there's a bit of a reduction there. You also see the open enrollment. That's new only, and that's from February 1st when the window opened until today with that, or August 4th when we took those numbers. So you can see in the past we've come to the September meeting with some pretty wide gaps between in and out, and that's much narrower than it had been. So hopefully that trend stays, and we're still not ahead of it, but we're trending better than we had in the past with that group. One other thing that we thought was interesting, and Dr. Hiltz asked if I would look into, a quick look at families that left our district last year compared to returning students this year. You can see 42 students who, for whatever reason, left our district last year have returned to the district this year. So we've brought back 42 students who left for whatever their family's reasons are, and we've brought them back with that. So that's a quick overview. One other thing I would point out to you is if you look at the elementary school enrollments, you see a fairly significant drop for G.D. Jones. Keep in mind we added 6 sections to them, and those students were fully enrolled in Jones, and they were there and accounted for on that May 20th date. So when they naturally go back, it's going to look like Jones took a huge drop. They really didn't take that big of a drop. It's because we placed those 6 sections there. If I compare Jones from August 4th to January 1st, they're down about 40 students. So they're still down, but not as bad as what that, as significant as what that graph would show. And as I look into those grade levels, it's really a smattering across all grade levels, no big drops here or there. Mm-hmm. So you have all the other information in the graphs. I'd be glad to answer any questions or take any comments about the information.
So John, just to clarify, the increase of 288, 42 of that 288 are kids who left the previous year and are coming back this year.
Yes, they would not have been counted in that May date.
Okay.
So that 42 is part of that, yes.
So that number that we had last year, and the context around it is important, that we, there were 470-ish, I think was the number that had left the district.
Our open enrollments out were up in the 400s.
Okay, and so now we're saying of those open enrollments out, 42 of those came back.
Some. There are some of those students were homeschools. That's probably the biggest chunk of that 42 coming back were homeschool students. I would have to, I don't know if they count as open enrollment for homeschool. We did bring back some students from DC, Everest, and Moseley and some of the surrounding districts. So I can't say that they're all open enrollment kids.
I'm just trying to size the opportunity that we have left. Because I think to myself, if that 470 didn't happen last year, right, just assume that was net neutral, we would have seen, as I interpret this, an increase of 288 students this year from 2 years ago. If we finished 2 years ago with 8,000 kids,
yes.
Last year, let's say we lost 500 just for round numbers, open enrolled out, we would be down to 7,500. I know that there's some more ins, but we got 42 of those 500 back-ish. Is there still a pool of kids out there that we can go recruit and say, hey, we're back in business, live in person, or have all those opportunities been exhausted?
I think that, you know, we continue to market the district and share the positives and seek new people. Open enrollment applications are constantly coming in,
right.
and the people are filling them out now. That you will see our numbers now compared to what you see in the fall are still very, very low. So I think there's an opportunity with the right marketing and the right reach out to capture some of those back, because there's a big chunk that are coming yet.
Okay.
If that's what you're asking.
Yeah, I'm just trying to figure out, I mean, obviously we're not going to get, 500 new students moving in from outside of the district, but anything that we can do to recapture that,
right,
a bigger portion of that 470 would obviously be beneficial for everyone.
It would.
So,
on the positive side of it, we are up significantly,
right,
and we're up than what we had even projected pre-pandemic with it. So, and we're edging in the right way. We're making some positive gains here,
which goes against the projections that we initially had.
Yes. If you looked at the demographic report, you will see that these are above those projections.
Which is what makes that all the more frustrating, because think if we didn't have the growth is good, right? It provides more jobs, it provides more opportunities, more support. So now we just got a bigger hole that we have to fill out yet.
Yes.
John, after the Monday count, this is always afterwards. It's like taking an exam and you find your score. Well, I didn't study hard enough. It's a little late right now. But could you put together maybe a 5-year plan up to this point, instead of us just comparing last year, how many we lost? Could we take a look at a 5-year plan up to this point, so that we can see what we lost in open enrollment, what we gained in open enrollment, and then what we had last year, and then we can compare it to this year's count, at least the first count.
Yes, and that's the third Friday count that you'll see in late October, early November, and that'll really have that 5 to 10 year, 5 years, 10 years, 7 years worth of data, depending upon the area. This was just a quick, hey, can we give you kind of the roundabout way of where we're at? So yes, you will get a much more in-depth demographic report for the entire district.
Because that can help us set our plans for the next 5 years after that as well. How we can start looking at recruiting, identifying what we give as programs academically. Those are important things for communication, going out to the communities around us that we offer a lot.
Yeah. So once we submit our report to DPI for the third Friday count, then you'll get the whole 65 pages worth.
Yeah. I look forward to that.
Yeah. Me too.
And just to clarify, this is a good thing.
This is a very positive.
Yeah, I didn't want to leave that message out there that because of last year, blah blah blah. This is extremely beneficial.
Yeah,
we just can't let our foot off the gas yet.
No, we're making good gains. We've got some families coming back. Some of the gaps we wanted to see are at this point shrinking, and online enrollments are coming in all the time. So it's very positive.
Can I just ask a quick question? I deal better with like real numbers versus increases, and so I guess I'm just kind of wondering: are you able to give a vague, even estimate of what our 2019-2020 K-12 enrollment was, then what our 2021, and now the increase of 288, which is really positive and fantastic. I'm just trying to figure out, if we're looking at this year compared to last year, it really doesn't give us any sort of understanding about where we are returning from the year previous.
So if I look at, and what I have at my fingertips here is just the K-12 enrollments pulled from the demographic report that Mr. Boucher was talking about. In 18-19, now this is K-12, so we're leaving out a significant portion of 4K and early childhood students. So if you look in this report, that's 424 K students now. So, but just K-12, in 18-19, we had 7,764 students, K-12. And we had been projecting some declining enrollment. So in 19-20, we had 7,664. And then the final count, now again, going back to September, K-12, these are September numbers, 7,335. So we're coming back up here if those are the numbers you're looking for, Karen.
So that was 2021, and then now estimated for 21-22, it is what? with K-12? Because we have 4K through 12, which makes it a little.
We are looking at, let me just pull that up real quick. If I look at the numbers that we have right now, right now, 7,918.
7,918?
Yeah.
Wow, okay.
So we tally it all up. That's early childhood through.
So that's 4K then? Through.
Yeah, that includes
okay,
4K
so that
in that.
includes the K.
So if you'd be looking at about 7,500 there if you took out the 4K.
Okay. Okay. Got it.
Does that help?
Yeah, so it shows the increase but not return yet.
Right.
To the 2019, 2020
Yeah, we were making
year.
very positive
Great.
strides.
Okay, thank you.
We're going to get Bob out of that declining enrollment exemption status pretty soon.
That's the first step, getting out, right? And then we can recognize some positives. Gotta get out and go first.
That's going to shave a whole paragraph off your yearly
Mm-hmm.
production, isn't it?
Trying to give a question.
Just on the topic of enrollment, the board has seen, some emails coming in on some concerning class sizes at a particular elementary school, and I doubt that the answer can be provided today or tonight. But I guess just wondering about some of those class sizes and the concern that's coming in from parents and from some of the staff on potential solutions to make sure that those class sizes and those students are addressed. I had my own experience with my twins and large class sizes and what they went through, and so just curious if what the conversations are and what potential solutions are for those large class sizes. Obviously our goal in the next year or two is achievement gap, and class size can be one indicator of how some of those kids will perform, especially if they're kind of behind some of their peers and underperforming. So
Yeah.
I don't know if you guys are prepared to talk about that
We
stuff.
could talk broadly about it.
I could give you the quick answer, and then there are much more knowledgeable people in the room around those kinds of detailed questions that you're looking for. I can tell you that all of our elementary class sizes are all currently within the board-approved guidelines. So we don't, I believe, unless something has changed since the last time we talked, have anybody or any classroom exceeding those guidelines with that right now. And yes, Tabitha and Angie and Julie and the ed department are very aware of the numbers in the sections and how it lays out, and constantly looking at those numbers. As far as potential solutions and things, maybe we could come back or I would defer to them around those questions.
And if I could add, so the class size guidelines that the board, I don't know how long that's been, it was way before me. Those are steeped in educational research. Class size has a very small impact on student achievement. Matter of fact, it's less than just growing a year older. So a class size of 29 in an upper elementary is a pretty common scenario across the state. So I think they're reasonable guidelines. Currently they read, I think, for instance, at 5th grade, 4th and 5th grade, it says 25, but up to 29, and we've been talking, that confuses people too. I wonder if we just go right to that upper limit, and clearly if we got close to, if we got within a few, then we would start to look at staffing. We look at staffing in, is it February or March, I think, is when we start looking at our staffing numbers. So anyway, the board guidelines are steeped in solid educational research. One other just comment I'll make, when I came here, I was not familiar with the idea of district placement, which, for those of you who don't know, if we do max out a grade level at a school and another child moves in, we actually move them then to another school that has space. And at first I was pretty opposed to that, the idea that a family moves in, they can't attend their home school. The philosophical basis behind that is, like I said, we post for positions in March, April, May to make sure we get the top candidates. And if we are looking to hire teachers now, the likelihood of getting a top quality teacher, which is what we really expect, is much lower. And so we feel that having a class size of 29 with a top-notch teacher is more beneficial to
students than having a class size of 24 or whatever, 23, with a teacher that may need, just say, additional support. So, just to throw out a couple of guiding thoughts.
The way that goal of 25, max of 29 was explained to me, Jane, you and I have been here for a long time, but was that 25 is sort of the goal where if adding another section would put us at 25, then the board approves that it's an expense. It's $100,000. You don't just add a section; you add an employee.
Yep.
But if it drops you down to like 20 or something, then the board doesn't approve that expense because it's a district-wide thing, right? So we would never look at just making exceptions here and there. It's a district-wide thing. It would be what's our policy for the whole district in terms of what the goal is and what the cap is. That's how it was explained to me.
Yeah.
But once you hit that cap, the board says don't go over that cap.
Right. Yep. Thank you. That's good background.
And
okay.
As far as not adding students just because they move into the neighborhood at the schools, that is cut and dry. My grandson moved in with me and he could not go to his home school. He had to go across the river to a grade school.
Mm-hmm.
So it happens and it's understandable.
We've turned down open enrollment students in the
Yep.
past too, which is huge funding if you think of how long you would maybe have them.
And just so everybody knows, we do provide transportation if we have to district place, so everybody's aware.
Okay. Any other questions for John? All right.
Thank you.
Thank you. Good news. All right. Up to letter C, 2021-22 back to school planning, possible action requested.
I can start, and then Angie is our local expert. So clearly we've been having a lot of conversation with principals and nursing staff and other districts about how this school year should start, and you can see there's clearly an interest in how that's going to happen. So as we've been having our conversations, what we would like is for students to have the best year ever. Really, that's kind of the driving philosophy. So that means interactive instruction. It means being on the playground. It means being in the cafeteria. We learned a lot of lessons last year, and I think we made some decisions that made a lot of sense at the time. And now I think what we're proposing is that we start the school year in a fairly normal mode. There's a couple things we've learned. For instance, at the elementary schools, the principals and the staff requested to continue what we're calling a soft start. So before last year, when students arrived, they would go to the playground or go in for breakfast at their choice, and then they would all come in. Staff and I think parents and students really enjoyed the opportunity to go directly to the classroom, eat their breakfast there, and then get the day started. So I think at all of our schools that was a request to continue that. So we will continue that. Otherwise, I think the schools will look quite a bit like they did. I'll just bring to mind, with the end in mind, the two motions. As we talked about this, there's two things that we're looking for from the board. One, last year, our staff, our nursing staff, our administrative staff, others spent a significant amount of time and energy doing contact tracing when there was a case, and also contacting families about quarantines. And frankly, I think some of our staff took a little bit of abuse for playing that role. In our conversations, we would like to not do that anymore. We did get a legal opinion, the idea of quarantining, and that is the responsibility of the county health department. Clearly, they would like us to continue, but we really feel that we want our staff to be serving our students and their families. So the first motion, if the board would approve it, would say that our district would not engage in contact tracing or efforts related to facilitating quarantines. Then the second one, then Angie probably has things to add. Secondly, as we are starting the school year more open, if cases start to appear,
we would like to know what the board is comfortable with as far as administration mitigating, that transmission. And I've got some suggestions here. Would the board be comfortable if we saw some hot spots emerging with requiring masking in a classroom or a school? Maybe reinforcing some distance expectations. Remote learning may have to happen if that. So I guess we want to know if the board would be comfortable. To what extent would you be comfortable with us managing the mitigation of the virus? Let me pause there for a second. Angie, did you have?
I don't have a whole lot to add. I have all the guidance right here in case if you guys have questions about anything. I can look up any of the guidance for you. We know that we can't have all of our kids in the schools at the same time if we do 6 feet of social distancing. We know that's not possible, so we would have to do a hybrid version if we would go back to 6 feet of social distancing. 3 feet of social distancing can happen in some places, but if really we want to make the best learning environment for kids and you're spreading kids 3 feet apart, some of those kids, it's going to be like last year where they can't see the board and they can't interact with others. So if we want to go back to a more normal looking school year prior to the pandemic, social distancing would pretty much be off the table.
So a couple of motions for your consideration, and again, there was one interesting piece. Jane did submit some items here for review. We also, Angie's been doing a significant amount of research. There was a surprising note, at least surprising to me, was there is some consideration around masking being a qualification where that would exclude the requirement for quarantining. So that's new. I would say though, however, it also still has to accompany social distancing, which again, we're saying, how do you get interactive instruction, which is a desire of ours, if we're engaged in social distancing. So we'd like to start the school year pretty much normal, and then have you consider these 2 motions and anything else you'd like us to help you engage in.
I have a question.
You're going to
on
start
number
the
1.
school year ignoring the CDC completely.
Thank you, Jen. Let me respond to that. I have a great deal of respect for the CDC and Department of Health Services, Marathon County Health. That is their area of expertise. Right next to that, we have a lived experience last year where we made the decision to get ahead of some of those recommendations, and we still had, I think, a better educational experience with little to no virus transmission. So yeah, I would like to start open and then restrict as the data indicates we should.
I would like to see us start with masks. I can understand the social distancing, and we have found that the virus isn't so much from touching things, it's airborne. So if we are wearing masks, we are not transmitting it in any way, shape, or form. Especially now, like with our high schools, we have a significant number of our students that are vaccinated, and even in the elementary with the staff being vaccinated, you don't know when you have COVID. So, I mean, you can be, and you don't have to be vaccinated and still not know you have it with the asymptomatic. It just seems to me that we are reliving history here with, as we did with the smallpox. There was a significant portion of the community that said, I'm not getting a smallpox vaccination, you can't make me, and not until their family started to be directly negatively impacted, then they got the vaccination. I don't want to wait that long. I don't want one child to die or to get long haul. I don't want any of our staff to die. I don't want any of our staff to get long haul or any more of our staff to get long haul. It seems to me that, we, in our community, we have students, our former students, now going to Stevens Point. They live here, they're going down to Stevens Point, which has a really high level of outbreak, and they're going to be coming back and forth every day. And then after reading most of the emails that came in, reading all the emails that came in, most of them dealt with misinformation or disinformation. They were emotional, they were political, but they didn't deal with the facts and the pandemic that we are currently in. The constantly saying, if you're afraid, you should do this. If you're afraid, you should. It's not about being afraid. It's being respectful of a deadly virus that is in our community, and masking is the way to go.
Jane, just one clarification on it. I don't know if I would have characterized, because I too read all those emails and sent all responses. To me, what I took away from those emails, the vast majority of them were parents saying, let me decide how I want to present or prevent or not prevent my...
But that is...
That's how... What?
Are you going to keep them in check?
No, I'm having a discussion with you. That was irrelevant.
All right. I am saying the masking, when you wear a mask, you don't wear it for yourself. You wear it for others. There is, I wish I would have sent you this, a picture of Petri dishes where people with a mask talk at it or cough at it or just breathe on the Petri dish, and then there's somebody that does the same on another Petri dish that has COVID without the mask, and you can clearly see the difference. Now when somebody comes up to me and talks to me without a mask on and they have COVID, that COVID flies over to me on a vapor and lodges on my mask. As that vapor droplet that dries, that little virus can get through my mask. This is about thinking about other people. It's not about being selfish and saying, I don't want to do this, so I shouldn't have to.
No, I'm not disagreeing with any of what you said, other than my personal interpretation of those emails was more on the choice side of the thing, not necessarily science or no science or political or no political. To me, it was just saying, let me do what I want to do.
I understand that the people that wrote these emails are 100% invested in what they wrote.
Right, right.
But what I'm saying is they are relying on misinformation and disinformation and putting their children at risk and other people's children at risk. And these children also go home, like my mother lives with me. There are a lot of 3-generation families, and these kids go home and they could take it to somebody else who has immunosuppression or whatever. And I know people that want the vaccine, but because they have an immune disorder, the vaccine didn't work. I mean, they got the shot and they never felt sick, and they went and got tested and they got no immunity from the shot. We're putting those people at risk when we say, I don't want a mask.
I have a question on the first motion.
Yeah.
I have comments on masking. I'm sure lots of people do, but I just wondered if we could hit that first motion first, because I think that might be a little quicker.
That's the plan.
I understand the request not to do the contact tracing. What impact does that have on the quarantines? Obviously, it impacts who we know is within contact, but what impact does that have on the quarantines of somebody who tests positive, for example? Does it impact that at all?
So, go ahead. Yeah.
No, the health department gets that information for people who are positive. So they would make the contact with that positive person. We don't have anything to do with that.
Okay. So it wouldn't actually change our quarantine rules at all. It just changes, we're not going to have staff members spending the time to try to chase down every contact of that person.
Right. And contacting families.
Right.
Last year we just heard so many times when families got a call from our staff about the need to quarantine, they were questioning, why do we have the authority to require or request a quarantine? And yeah, so yeah, it would. So the quarantines themselves would not change, just who's doing the work to facilitate it.
But we would be notified about who is quarantining, so if they showed up at school, we would send them home.
That is the hope.
Right.
Yeah.
Yes. I will say that the health department hasn't been really quick with getting us that information. So we just found out 2 weeks ago that we had some cases back in June in summer school that we weren't alerted about until the end of July. So I think if it's a positive case, they have to let us know fairly quickly. The rest of them who are quarantined, I'm not sure how that looks.
That's interesting.
So what you're saying is that if it's a positive case, you're very likely to hear that very quickly. So
Yes.
that quarantine would be in place. The health department would be responsible for that. Whoever those persons may have come in contact with might not necessarily be quarantined, or you may not get that report immediately.
Correct.
Yeah.
So Angie, you're still working closely with the health department though, correct?
Yes. Well, we're receiving, the nurses go to meetings with them once a week, and then we receive the situation report once a week.
And could the board get that report? I know the county board gets it. The weekly
Yeah.
county.
I don't know how you get on the email list, but.
Is it something that
Aren't there some questions about privacy of information and public health information and all that sort of thing? That PHI stuff is really important, and I think that there may be some question about who gets that information.
That's, HIPAA is for doctors and medical personnel in hospitals.
Well, we have an agreement signed with them. So the health department had an agreement with all of the school districts during the pandemic to make sure that we didn't run into any of that. But regularly, normally, yes, it would be an issue.
So it might be an issue, it might be important for you to know it, and for you to know it in administration, but it wouldn't necessarily be important for that information to be disseminated to everybody else.
Certainly not names.
HIPAA is based on minimum necessary.
Correct.
So.
Yeah, and I'm not interested in knowing names or anything. I just want the weekly report that the health department puts out about the basic numbers and everything.
If they send it to
Weekly
the board,
report
you would
doesn't
think.
have any PHI in it. It just has general numbers, and so,
Correct.
like, I could send you last week so that you could see an example, and then if any of you want to be put on the list, you could reach out to the county and ask to be put on the list. I think it's a public document, as I understand it.
But you said it already goes to the county board, right?
Yeah, it goes to the
So
county.
it must be.
Yeah.
Yeah, it's
I'll
just
forward it.
numbers. It's just numbers, like there's no,
Okay.
there's no names or, it's just numbers. It's just data.
So Tabitha, if you get it, I guess I would just ask if anyone's interested in receiving it on a regular basis, can they just contact you? Like personally, I don't want it. I have no interest in it.
I don't have an ability to add the people, though. It has to come from the county, so my thought is I'll forward one copy.
Okay.
If you want it, you can contact the person who sent it originally,
Got it.
and they can get you added.
All
I
right.
think that's probably the best way.
Perfect. That
Yeah.
makes sense.
Yeah.
Thank you.
I'd like to know why you aren't interested in what the numbers are in the county.
I can read on their website where we're at for the county.
Oh, okay. I just was
Yeah.
wondering, it just would be, seemed
No.
easy if it would come to your email instead of having to go look for it.
No, it's.
That makes sense.
I do it frequently, honestly, so I just have no interest in getting another email, quite honestly.
The chamber distributes it pretty regularly too.
Yeah.
I have a question, Dr. Hiltz and Angie. Did you guys see the COVID-19 infection control and mitigation measures for Wisconsin schools that was released by DPI?
We did.
On Friday? Okay. Because I read through it. It's about 22 pages. And there are recommendations in here. And they talk about layered mitigation as well. And so I know they say in here that contact tracing is, based on the school district, we can decide to do it or not to. But other recommendations that they're talking about is promoting vaccination, cloth face coverings, masks. They talk about physical distancing. I mean, they're saying 3 feet, and so they also talk about ventilation, cohorting, yes. And so are most of these going to be taken into consideration, and which ones are?
So we were talking about the ventilation again. Matter of fact, just today. Did we agree to cohort at the elementary, or did we not? I can't.
Do you want me to go through the list?
Sure. Yeah.
Okay.
Would you mind? Thank
Sure.
you.
Promoting vaccinations. Yep. So we do that. We have them in all of our secondary buildings, in the bathrooms, and we put them in the newsletter. And of course, we'll do that at our elementaries when that vaccine comes out. Right now, we're hearing late fall, hopefully they'll be able to scoot that up a little bit. You're right, the masks are in there as a universal precaution, so is social distancing, and they've made the exception for 3 feet just at K through 12 buildings. So anywhere else in the world, it's still 6 feet is social distancing. They do recommend, or they say that it's available to have screening testing done in buildings. Of course, staying home when sick and getting tested, so we will be continuing that. If kids come to school sick or with symptoms, we will be sending them home. And again, the contact tracing with isolation and quarantine, ventilation, and then cleaning and disinfecting. So the CDC has said that cleaning once a day is appropriate in all situations, except if we have a case of COVID, and then we would disinfect as long as we find out in enough time. So if, for example, a few weeks ago, we had the Parks Department in one of our schools and there was a case, they didn't find out about it till a week later. At that point, it doesn't even pay to disinfect. Time has done that already. And of course, hand washing. We'll have hand washing schedules for kids in elementary, especially hand sanitizer. We're stocking up. Larry and I talked today about what we need to stock up on.
Question.
So what's the first motion?
So the first motion is, and we can continue the discussion too if needed, I would be seeking a motion that the Wausau School District will not engage in contact tracing or efforts needed to facilitate quarantines.
So move.
Second.
All right, we have a first and a second. Any other discussion on that particular one? All right, all those in favor?
Aye.
Aye. Opposed? Motion carries.
Thank you.
Okay, so on to number 2. Dr. Hiltz or Angie, I don't know if there's anything you wanted to clarify about this one, or...
Yeah, we were just, and I will tell you that, kind of hearkening back to last year, I thought we were going to get transmission. We didn't. I know we had a lot of efforts in place. While we want a really effective and enjoyable educational experience, if we start to see cases, we want to be able to respond. So I guess this is our proposed motion. I wonder what the board is the board comfortable with that motion, or are there some concerns that we could speak to?
Well, I'm concerned because we keep saying kids, there was no transmission. But with asymptomatic, we don't know if there was transmission. We don't know, who took what home and who, we just don't know.
Okay.
When you mentioned virtual education in that motion, are you describing sort of an emergency situation, such as an outbreak we have to close down for today or the rest of the week or something?
Correct.
You're not talking about making a decision, we're going to go back to hybrid or something?
This would be by classroom, likely,
Yeah.
or if there was a couple of classrooms, maybe an area. We've learned, we had a really good conversation with the principals just last week. We were talking about, this is just kind of an aside, but also relates to this. If students are quarantined or if they're ill, can we continue to support their education with remote learning? Could a teacher send out a Google link and the kids could log in? As we started to talk about that conversation, the principals shared with us the experience from last year where teachers really understand the needs of their students. And there are some students who you could give them a link, they aren't going to log in. Other students, they would certainly log in and engage in that instruction. Others need paper copies, and the teachers know that. So we are really hoping to lean on our nursing staff and our teachers and principals to kind of help us guide the decision making. So it might vary a little bit by school, and so I guess, yeah, we were thinking short term. A couple of days, and that we would request that staff person and those students to be remote learning, and then bring them back. But again, we work with the building staff to make a determination on length.
Yeah, to me that makes sense. That most of those decisions, I think, are administrative decisions. If it rose to the level of the method of education for the whole district, that kind of thing, I think is a board decision. For me personally on masks, I think that universal masking would be effective, but we won't have universal masking. And so I think that within a couple months of the year, if you compare districts that are masking and districts that are not, you're not going to see much difference. And you're squinting at me, Jane. And
I'm just wondering why.
It sounds like a conflict.
Yeah.
But the reason I think that is because it's a community spread issue. And so I don't think forcing people to wear masks in a school building who are then immediately going to take them off and go on with their life the same as they did before COVID is going to make a difference, which is, maybe I'll be wrong, but that's why I think that it's a community issue, not a school issue, and so I don't think we would see much difference, because the people that they don't believe in masks, they're not going to protect themselves, they're going to interact the same as they did before. They're going to do that whether we have a mask requirement in the school buildings or not, and so I don't think you're going to find out much difference. If that's wrong, and we see there is a significant difference in the districts that mask versus the ones that don't, I would expect administration to respond to that and institute a mask policy. I've never thought masks were like this big, horrible, terrible thing that are taking away my freedoms. I mean, they're a minor inconvenience to most people, and so I would put masks on that same level as distancing and sanitizing, and I don't put them at the level of the method of education. I put them at that where are the desks placed and how are we sanitizing and how are we cohorting level, and I would leave that to administration to decide based on what we see in other districts, and I really don't think we're going to see a difference in the schools, districts that do versus those that don't.
But the ones that I'm concerned about are, I can feel bad for the kids that mask get home and just go about like there's nothing going on in the world. But it's the ones that come in, they wear the mask, but when they go home, if they go to the store, they're wearing a mask. They're taking the precautions all the time. And by bringing them into school without taking precautions, that opens up an avenue to them that they can get COVID. Where they're
I don't think there's a perfect answer to it, because I don't know for sure what the result will be. I know that
I just don't like the thought of experimenting with
some parents are going to vote with their feet and move their kids to different districts if we put in a mask mandate before we see evidence that I think it would be different if we see evidence in our district is higher than in the district that's requiring masking, and then we move to a mask requirement. Then I don't think you see parents react the same as they would if we went to a mask requirement right away. I think if we had something to point to and said, look at our rates are higher than DCR versus requiring masks, and we're not, and I'm just making that up, and their rates are lower, and then we went to a mask requirement, I don't think you would see parents react negatively like you would if we went to a mask requirement right now.
Well, but what is that threshold number? Is it just the number of COVID cases? Is it a dead kid? Is it a dead staff member? I mean,
I don't think we can draw a line. I don't think it would be useful for us to spend time trying to draw a line. I think it's going to be like it was last year. I think it's something that we evaluate throughout the year, but I would like it to be more on administration's shoulders to do that evaluation throughout the year, unless it rises to the level of the method of education. Something beyond a day or two of virtual because of an outbreak. If it goes beyond that, then I think that needs to come to the board. The other stuff, I think it would be better for us as a board and for our district as a whole if that is left to administration to administer, as opposed to us having that battle every month.
And there's nothing that precludes, there's nothing that precludes parents from sending their child every day with a mask.
Yeah.
Or two masks.
But that's not how masks work.
Well, but they kind of do, right? I mean, PPE is personal protective equipment. It protects you personally. N95 is based on how many particles get through.
Yeah,
right?
an N95 might do it, but an average mask, it requires the person with COVID to be wearing the mask.
Okay.
There's actually two discussions here, one academically and one from the medical aspect. I'm going to go and move us a little bit to the academics. We have, because of this year, our teachers have learned how to teach remotely. If we have to close down, our teachers will still be able to teach and our students will still be able to deal with things, and that's an administrative decision based on what you find in the individual schools, and you'd be looking at all of these individually. So I'm more concerned right now with how much we've lost academically throughout the last year, and how are we going to catch up, and how do we not fall back again. And so I'm going to give a lot of applause to the administrative team for getting our teachers up to speed, dealing with the virtual teaching, and now teaching better from that point of view so that we don't miss a day. Say we have to close down a day. Our students won't miss anything because the teachers are prepared. Going into the school year like this, from my point of view academically, we could close down for a day or two and we wouldn't miss a day or two. Just like if we missed a snow day. We won't miss a snow day anymore because our teachers are prepared to work with our students, and our students will be prepared to work with them. So I think if we get to that mask situation where you decide that we have to mask somewhere, we're ready now to continue to teach and to learn, and still with differentiation versus simply doing it one way for everybody. As we take a look at our educators here, we know that those are the two discussions, and so we need to keep both in hand and not forget one versus the other. Just my 2 cents on that.
Maybe the question was already answered before, but maybe I missed it. Are we still doing cohorting?
Good question. So at the middle and high school, cohorting is incredibly difficult. At the elementary, it's doable, but if you're going to cohort a classroom, then you need them to stay together during lunch and during recess, which is kind of putting us back to where we were last year. And that was a large gripe of parents and kids, was that they couldn't play with their friends, and that social aspect was really lacking last year, and we're seeing that in kids coming in. We saw that in summer school this year. So at this point, we're not planning on cohorting.
It's not just social either. I mean, our elementary teachers can't teach, can't have the kids come immediately to the rooms. I know you said they're going to start in the room, so that's prep time they lose in the mornings, and then have them stay in there at lunch and stay in there for encore and stay in there for recess. That's why we went to 4 days a week, because our elementary teachers can't do that. So that would be one of those things that I think would rise to, at least for me, to board level, because they can't do that. They could do that for a short time, but they can't do that for the year. There's no way.
As long as you, if I could just respond one quick thing, the soft start, the losing of the prep time, Mrs. Gundram's been working with the teachers union on how we can offset that with some time, with some is it time or money?
It's a teacher choice.
Yeah.
So there's a stipend for the whole year, or there's some release time with the building sub that can cover for a half a day a month.
Right.
So each teacher who's in the position of covering for soft start will be given that choice, and it will be a personal election. So we might have half and half in a building, and that's okay.
Yeah.
So I know like 15 minutes doesn't sound like a big deal, but we're talking about teachers when they retire at their retirement ceremony. They talk about how it's so nice they can pee when they want to now.
Yeah.
Because they literally can't find 3 minutes in the day. Yep. You know, you say you have a half hour for lunch, but that doesn't work when you got a kid you have to help put on his clothes to go outside or take off when he comes back. The half hour is 15 minutes, you know, so that all adds up and it makes a big difference.
Yep.
Yeah. Tying shoes takes a long time when you're an elementary teacher.
So, yes, so the reason why I asked about cohorting is, Dr. Hiltz, you mentioned that, you know, if there's an outbreak in a classroom, you know, that classroom will go virtually. But if they're not cohorting, if that class is mingling with other classes and those students like get an infection, you know, then wouldn't that mean that it would be more than just one classroom that would be virtual?
Possibly.
Okay.
Now, being outdoors, of course, makes a difference.
Yes.
And recess is short, so recess is only about 15 minutes, and actually by the time the kids get out there and start playing, it's less than that. So recess, it wouldn't necessarily matter because they wouldn't have been exposed for 15 minutes or longer. We could do lunchroom where the kids are in the lunchroom but still have to sit with their class. which would eliminate that risk during the lunchtime hour. So you're right, if there was a quarantine, if we're going this route, it would be an entire classroom, because we would not be able to distinguish which kids had been within 3 feet of that child or not.
And everything I've read is with the new Delta variant, the 15 minutes is gone. You can be
That's still in our guidance.
Okay.
Yeah.
Can I ask a question with regard to, if this motion were to pass and these decisions get brought to the administrative school level, teacher classroom level, I guess my question and or concern is, are those decisions going to be consistent across the board for the district based on a metric of sorts, or it's this teacher's uncomfortable or this principal is, and the teacher in the next door classroom would decide otherwise? I guess that I just wonder if we're opening a can of worms when we say you get to decide what you want to do, you get to decide what you want to do, and all of a sudden our district really is.
That's a really good, that's not what I meant when I, so that's a really good point. So I'm glad you brought that up, because that's not what I meant when I said I support administration.
Yeah.
When I said administration, I was looking at you, because I kind of thought like you'd be making that decision for the district, not we wouldn't put that on individual teachers to have to make that decision for their classrooms.
Or individual principals.
Yeah, and to, I mean, but we would certainly consult with
Right,
them.
right, for sure.
So to your point, we've been looking for some metrics that, and I've not found any. That would be ideal if we had some measure that said, hey, if at this point you should do this. I know Dane County Health Department had some really complete recommendations, and we read through all of that. We haven't found anything there, nothing nationally. So I don't know if maybe you've run across anything. I would certainly be open to that.
That's the problem with all of it.
What's that?
Well, that's the problem, is there just really isn't, and so that's my concern.
So all of that would come to us, and then we would help the principal make a decision, because we don't want a million things happening in a million different classrooms, because that's going to be bad too. Then you're going to have parents at one school saying, well, at that school they can do this and we can't at ours. So it would be us working with the individual principals to help keep some consistency, but to make site-based decisions based on their students.
And the nursing staff.
And the nursing staff.
I mean, I would think you'd want to keep elementary schools pretty consistent. You may find division between secondary and elementary. It's two different scenarios, but like you said, if you have two different schools, elementary schools doing different things, you're going to have that.
Yes.
You'll be getting transfer request forms.
Yeah.
That would be a problem.
Other than making a decision that we're going to all mask, all social distance at 6 feet or 3 feet or whatever as a board, the proposal from the administration makes a lot of sense. They have their finger on the pulse and they can react, and everybody cares about kids. Nobody wants kids to get sick. But we also know that kids are going to get sick. Adults are going to get sick. And we can do the best things that we can do to support education and the mental health and the physical health, but the ones with the feet on the ground that can make the quick decisions have to take place at the administrative level, unless we're going to make a firm mandate.
I disagree with the administration being able to make mask considerations or decisions for parents, and I think that decision rests with parents. It's a health choice between parents and their students. Last year we dealt with a lot of hypothetical what-if scenarios that decisions were made on, and none of it came true, and yet a lot of failing grades and suffering took place in the district emotionally, physically, psychologically, and here we are trying to repair that and move forward. I believe that masking is a choice for the parents and the parents alone, and that's where it should reside. I don't think the administration should be making that decision for everybody. That's my opinion. So,
and that is one question I guess that I had, because we do have a policy on masking, so we would essentially be authorizing administration to make exemptions to that policy on an as-needed basis.
Correct.
And I'm trying to think, have we done that in other examples or situations.
Well, we don't have
Never
other
been
examples of
pandemic.
situations where we have a
No,
policy
I
that
know
dictates
that.
what people wear to school. I mean, not to that specificity, you know. I mean, we don't generally have a policy for a thing like that. We don't usually make policies for administrative decisions, you know.
And I think we could get rid of the mask optional signs if we're gonna have them, because masks are always optional. It's either mandatory or it's not. And
Yeah,
the only
I
thing I heard of was this summer that some kids were bullied for wearing their masks, and then they didn't want to go to school anymore.
There were also a lot of kids that didn't come to school because they didn't want to have to wear their mask. We're ignoring the health and psychological effects. And there's an MIT study out there. I happen to be in HVAC. We've all breathed each other's particles of air in the amount of time that we've been sitting here, probably about 4 or 5 times over. So
if the room doesn't exchange the air.
Well, and it depends
I mean,
on the
that was that
filtering
study.
and yeah, it depends on the filtering and you know how many times the air is exchanged, and there's a lot that goes into that. But this is you know, we're dealing with a health choice for parents, and again, a bunch of hypotheticals and what if scenarios that never came true last year. And again, we're talking about hypothetical what if scenarios again. You know, I don't know why.
Except with a big difference with this time, the administration wants to start without masks and only go to masks if the evidence changes, as opposed to last year it was start virtual, play it safe, and then go back. Because that would be the other option, to start with masks and then see if it's making a difference. But administration is recommending we start without masks and only go to masks if we're seeing that there is a difference in, you know, where that masks are making a difference in this district or that district or whatever.
Well, we kind of saw that play out last year, right, with when we finally got back to school in this district. Mosinee was a district that had masks optional, and per capita, our transmission rates were relatively the same, right? So therein lied an experiment demonstrating that masks, it didn't really matter in terms of the transmission, like you said.
In our summer school too.
In our summer school, and you know, when those students go home, they're either taking off their masks or going and doing whatever it is they do in the community. Like you said, it's community spread. So the hypothetical what if scenarios, I just don't think need to be a part of this. And I don't agree that the decision should rest with the administration whether kids should be wearing a mask or not, because I can see that going down a rabbit hole, you know, without metrics and things of that nature to make a decision. You know, when is that going to happen? When is it going to be required? So.
Well, to be honest, Mosinee can do whatever they want. I mean, we're not Mosinee, we are Wausau. So, and DPI says that they strongly recommend masks.
CDC does too.
And so does the CDC. So, are we going to go against CDC and DPI again? Is that what we're going to do again?
And what legal standing does that give us? If we say we're going to ignore this and do our own thing, what if we get a kid that gets horribly sick?
Lots of good questions all around. Again, so going back to Mr. Creasy, just so you don't leave your points, because you make good points. Again, in this case, you're right. I think it was that experience that really leads me to be pretty confident in starting the school year fully open, contrary to recommendations. You know, that does give me a great deal of confidence. Secondly, you know, if that bears out to be true, that you know, we aren't masking, others are, whatever the case may be, and we don't see a difference, then that would not you know, suggest that we would do masking, right? So I guess until there is some data, it wouldn't be based on hypotheticals. In this case, be based on data driving that decision. I understand what you're saying. That's kind of where.
But the issue is we had kids wearing and staff wearing masks at school, and then so many of them went home and ignored that. So we prevented the spread from happening in school, but they were still out acting like we were not in a pandemic. We also, the original COVID-19 was asymptomatic when kids got it, so we don't know. We don't know what the rates were in Mosinee. We don't know what the rates were here because we don't do testing. Although Delta, the kids are getting symptomatic. Down south, their juvenile ICUs are full. And Delta is what we've got now.
That they that you refer to is a bigger percentage of our community now than it was then, though. So the they who take their masks, don't wear the masks, that's a bigger percentage of our community now. I would probably feel differently if we had some sort of statewide mask order in effect where all the businesses, everybody is wearing masks in public, and all the school districts, everybody's wearing masks. I wouldn't want to be the outlier that, hey, we're not wearing masks. Because then I think it would make a big difference.
Yes, I agree.
But where I don't think it's going to make a big difference is because we don't have all that. Everywhere we go, everywhere you are, people that spoke to us tonight about masks didn't have masks on. So, I mean, in the businesses, there's no masks. All around, there's no masks. So
two did.
It's, you know, it's, I just don't think I think it's going to prove true what Dr. Hiltz has predicted, which is that we're going to be able to operate as normal, and I think it's going to be fine. If it's not, then I think we have to make that change.
Well, and I think you've seen more people without masks because many of us are vaccinated now. I know the 3 people that spoke tonight, I would bet that they were vaccinated. I'm vaccinated, but I'm back to wearing a mask because the CDC says wear a mask.
I think I guess 2 points that I just want to maybe make is, this is the conversation we had, you know, in May when we actually moved to go mask optional, and we heard from some of the same people, and it was just you wait, we're going to have a surge during summer school. And if you look across, and I did on a weekly basis at our county website, our cases for the 7 weeks of summer school were nil. I mean, like 0, 1, 2 for weekly averages. So again, like these scenarios, they're just not playing out. Thank God. Like, aren't we glad? Like, that's fantastic. And so I think what we need to do is take a step back and look at what's real, what's happening. And I guess my concern with the decision is what I brought up earlier. I think there's the potential for there to be a lot of issue with inconsistent decision making on a case-by-case basis that could be really problematic for you. I mean, like, I don't know that I would want to take that on.
But if it does become an issue, then we will take it on. I mean, that's what we're here for.
For the whole district, you mean? If it becomes
if administration appears to be, you know, being more severe here than here, then we'll take it on. I have no concept that would even happen, but if it would, we could take it here.
Well, I just don't know how you can be consistent if there's no metric with which, you know, are you going to say, well, if there's 2 kids in the classroom, we're going to do this, that are 2 kids that are positive, or if there's 2 kids with siblings that are positive, or if there's 2 kids with parents that are positive, or if the teacher, I mean, it's just like, what in the world does that even look like? And then is it now everybody's masking, or everybody's virtual, or everybody's just social distancing now? I mean, it's just like the potential for just
that's the alternative
chaos.
To what we did last year. This is what we have. And I think as we start down this road, if a decision is made that 2 kids in this class have tested positive and they're going to mask, that becomes one of the matrix. So if the next class comes along and they have 2 or 3 kids that test positive, then they know that's what's going to happen. I mean, it will build itself. And as far as none of our kids in high school and summer school having COVID, we don't know that because we don't test. Kids can be asymptomatic. This Delta getting to the kids is fairly new, but half the kids could have had it this summer and we wouldn't know because we don't test.
Well, I just want to suggest, if we don't know that they had COVID, they weren't ill, and we can be grateful for that too, right?
Yes.
So,
well,
so that's probably a really good thing. Like, if we have to test to find out if we're sick, it's probably not something we should be concerned about.
Yes, it is, because COVID is contagious to other people, and if you have asymptomatic COVID and you take it to somebody
I know,
and they
I'm
die,
just saying for our students, right, is all I mean.
Well, I'm glad that they didn't feel ill, but they maybe were ill.
So back to the motion.
Yeah, I'm just going to say.
Wasn't the answer about kids being sick in a class was to go virtual in the classroom, right? I mean, like that. Yeah, right. That was the question that Ms. Vandenberg asked, and so we'd already talked about that, you know, if kids in a classroom, if one or two, there wasn't an infection, then the class would go virtual.
Mm-hmm.
Okay, great. And then, you know, I'm just looking at the county board, or the DHS website right now. And yeah, in the summer, we were low, moderate, but you know what? If you pull it up right now, we're in the red. We're in the red. This is August 2nd to August 8th. We're in the red. So we can say all we want to about the summer, that it was low, moderate. That is true. But the truth also now is now we are high as a county.
And I think we were high all of last year too.
Mm-hmm. Correct.
So again, under this very similar conditions, you know, we had very low transmission.
We don't know that though.
So I guess if they don't have symptoms, then why does it matter? I know there's a lot of.
Because asymptomatic, this can be like chickenpox. There are studies that show if you get this, whether you have symptoms or not, as you age, it lives in your brain, and it can turn out, it can make Parkinson's or MS. You know, just because you don't have symptoms doesn't mean that there's long term. People can have chickenpox, have one pox, and later in life get shingles. And it's the same thing with this. We don't know what the long terms are. So the kids maybe haven't shown any symptoms, asymptomatic, and who knows what's going to happen later in life.
When we talk about administration having a decision on some of these things like virtual, temporary, we shouldn't just talk about it like it's something new. That was already happening. We had times last year where a whole class had to quarantine, or there were too many hours, like we're not going to have class for 2 kids because 18 of them are quarantined, and they switched on the fly when it needed to, and they did a quick last minute virtual session, and we can. So none of that really changes. I think the one sticking point probably is the masking one, and I'm like I said, I put masks on that same. I know you don't, John. I don't think of them as that big of a deal. They're a minor inconvenience when I have to wear them. So I put them on that same level as all the other administrative decisions. So I'm comfortable with that. That would be the only main change. Most of this other stuff, administration is it's just part of your job. It's what you already do.
So if, I'm not putting words into your mouth, but just trying to interpret so we can move forward here. The motion currently says the school board directs administration to monitor school and community transmission and manage COVID-19 mitigation efforts, including masking, distancing, and virtual education for the 2021-2022 school year. What I think I heard is all of that was happening already except for the masking mandate, assuming because we have the policy.
Mm-hmm.
Well, masking, and then we jumped in and made the decision on distancing also, but I mean, so they'd be left to do distancing on, you know, where you can, and you can't. And,
right.
So
and changing if something changes, you know.
So is there interest in amending this motion, or is there an interest in tabling the motion? Because I'm not quite sure, based on what you were just describing, Lance, that it was needed. I want to do something to move forward.
Since it was clarified that the virtual education was just the type of stuff that is the temporary short-term thing, and not changing our mode of education, I'm supportive of this. Leaving it to administration, I don't think it's something that we need to. I don't think we need to discuss every single month. Are masks required this month or not? Is 3 feet required this month or not? I think if something major changes, and administration decides to add a mask mandate, and if the board doesn't agree with it, the board can always have a special meeting and change the administration's decision if they want to. But I'd like to give administration the authority to make those decisions along the way, and not to have a special meeting with us every single time they want to make a decision.
And I just don't want the I don't want to say the specter, that's too strong of a word, but I mean, we gave clear direction to everybody. Some didn't care for it, some did care for it back in May when we passed the mask optional policy. What I don't want us to do is to throw that dark cloud over there again. You know, I don't want parents sitting at home or telling their children.
Wondering.
Exactly.
Yeah. And I don't know if this helps at all. I mean, you know, I think you made really good points that if the rest of the community isn't masking, and we asked 20 kids to wear a mask with a teacher, or 29, whatever we have, for 2 weeks, would that really have a significant impact? I don't know. And with that doubt, I don't know how much we'd even use that tool. I guess I was just trying to, start this conversation to see where the board is willing to go.
Okay.
Well, if we're not including masking in it, then wouldn't you agree we don't even really need to do it? Because what's left? Just the distance?
And virtual.
Yeah.
Virtual. I mean, you already have authority to do
right.
a temporary emergency virtual, just like you would if a water
Sure.
main broke or if a snow day happened or whatever.
Yeah, the distancing,
I think the motion in some ways says the board is either in support of administration or we're not, or we're not. I mean, it really is supporting the motion in what administration is proposing to us.
Somewhat, but I won't vote for it because I believe we should do what the CDC and the DPI and the WHO and all the specialists say we should do. So I will vote against it for that reason.
All right.
And you'll vote against it because it's because it includes
Two
masking.
votes against it for the opposite reason.
I don't think that the administration should be forcing parents and kids to mask, and if they want to recommend it, then that's fine. The recommendation is fine. I just don't think it should be a forced thing.
Okay.
And if it's,
well,
maybe we should take
I mean, if we're going to start with it sounds like the majority of the board wants to start without masks and isn't comfortable making a decision today on they want to see what changes, and so I don't know that we even need to have the motion then. I mean, it doesn't sound like anything's going to change. If we're not including masks in, then there's no reason to have it. We could just table it.
I don't think we need the motion.
Okay, then I need a motion to table.
So, well, we wouldn't table it, we would just eliminate it, because why would we table it?
Well, if there isn't a first, the motion just doesn't happen, so we just move on.
Yeah, that's true. Yeah, I mean, it has to be resolved somewhere.
But if there's no first on the motion, it just doesn't happen.
It sinks.
Just goes on. I mean, Dr. Hills, other than the masking, do you think there was something else that we needed to give you specific authority on that you don't already have?
No, again, knowing the heightened interest in this topic, I wanted to make sure we had a real overt conversation about this. If the board is not comfortable with this, then we'll just use whatever tools we have available, as the data directs, and we'll carry on.
No, and I appreciate that because I like the idea of us not having a circus every month of debating back and forth the same stuff we debated the exact month before. I don't think it's good for us or for the district. So I appreciate that effort.
So are we tabling it, postponing it,
It just sounds like it's going
eliminating it?
So if you ask for a motion, we don't get one, then it just dies.
Yeah, there's nobody made the motion.
So we're
Never
just
made it that far, we probably should
eliminating.
discuss it then.
Well,
either.
no, I read the motion.
Yeah,
But it
I'd
has
rather
to be
discuss
moved
it.
forward.
Yeah, we can. All right. So, is there anyone motioning on motion number 2? Nothing. All right.
All right.
Thank you. It was good discussion all around. Okay, moving on to D, Esser staff requests. Ms. Cartwright.
Okay, good evening. Thank you for your time. I've come here this evening to talk about a request for special education staff additions using the Esser funds. They would be specifically to address accelerating skill acquisition for students across the district enrolled in special education supports and services. So what that would look like would be 6 paraprofessionals from EC all the way up to our 18 to 21 programming, and then also the addition of an early childhood special education teacher and also a middle school special education teacher to be split between both John Muir and Horace Mann. The cost would be $409,228 annually through 2024. And this would be looking at really helping us support some of our students who either weren't with us last year or who are making a transition into a different building or a different mode of school.
So this would be a 3-year.
Right.
These
Yep.
positions would be 3-year.
Correct, yep.
All funded through Esser. So when the Esser funds go away, then these positions, if not an alternative funding source found for them.
Correct.
Okay.
Correct.
Or, if the data were to indicate that they have, more of an impact than staff we already have, then it would just be a transition. But yeah, we have a number of short-term staff that are being hired through Esser for learning and recovery.
Is there, or maybe there was discussion about, and go back to the enrollment, the class size discussion that we had. Is there opportunities there for Esser funds to get paras in some of those larger classes? We kind of discussed what we call
Enrollment paras?
Enrollment paras.
Right, yes. Yeah, I know we're having that conversation. I'm not sure where we're at with that.
Okay.
Similar to the quality of the teacher making a bigger difference than the size of the classroom, the quality of the para is very important as well, because a good para is great in a classroom, and there are some that aren't helpful. So that's really important. It's not enough, just having an extra person doesn't help. It's got to be somebody that's skilled and good with working with kids.
And where does this fall within our priorities of the Esser funds? Like, do we have an accounting, here's our Esser funds of 15 million, here's what we're saying is going to go for it, or maybe we have 5 million spoken for and there's 10 left to go.
And Mr. Tess had done some presentations earlier on this, but we have prioritized, and we've accounted for roughly 13 of the 15 million, I think, Bob?
Probably about 14 of the 16.
Okay, all right, yeah. With high priority items, again, focusing on student need. Obviously, then some facility things that fall under this. Bob's much more knowledgeable. He has a whole surprise. He has a whole spreadsheet.
Is it 4-dimensional though?
Absolutely. Yeah, about that. So.
Okay, no, that's good. I just don't want people thinking that this is like just a one-off and somebody wanted to do this. It is in context with many other priorities, many other requests.
Yes,
throughout the
absolutely.
district. Okay.
Yes.
And addresses learning loss. And so one of the questions that we have right now are our students that could be served through early childhood. We're not sure how many students we didn't meet last year. One of the things we're doing is we'll have a booth at the Children's Festival, just an informational booth on early childhood and some of the services available, but we're anticipating once things get going and kids are back in buildings and families are out and about, that we may experience an increase in those early childhood referrals. And maybe not, and we don't necessarily have to add someone right away, but it does give us that ability to be able to address that need should it arise.
Okay. Questions, comments from anyone on this?
Just a question about the Esser money. I'm always caught up into that because we're at about 16 million, and it's got to be used at a certain period of time, first year, second year, third year. Are we going to get a complete printout on where that is? Because a lot of people end up asking us, where is that money going? And I'd like to be a little bit more knowledgeable on that. I always give them the canned comment that, well, we got to follow rules and regulations, and there's a specific aspect of what we can use the money for.
Sure. We talked a little bit about Esser at the board level in, I think, April, perhaps May. And I showed you general categories, and at that point, Esser 3 was just revealed. So we didn't know much about Esser 3, and the Esser 3 dollar amounts have still yet to be fully revealed. But 2 weeks from tonight, when I present the first iteration of the budget that goes into the budget book, we'll have part of that presentation for Esser alone. Talk about how we're using Esser money. We're using some of it for staffing. Makes us a little bit nervous because we have to have a plan for it to sunset. We're using some of it on buildings and grounds. We're using much of it on curriculum materials, technology. Those are the easy costs for Esser, right? Because they're easier to see sunsetting. But you'll see that in 2 weeks.
Okay. All right.
And are any of them going towards this additional staff request? Or
Esser, this is all funded by Esser.
Yeah, I know. I mean, but for her request, is any of that money already going to the special ed?
Other than this request?
Yeah.
Yes, if you have 2.5 staff.
Okay.
Yeah, the other ones you saw as part of the budget reconciliation, so they're, I'll take your word for it, 2.5, so.
I think
That's right.
Okay.
I just know early education is that PC is so important to get to those kids and make a complete different student.
For sure. Okay, any other comments, questions? If not, I will seek a motion to approve the use of Esser funds to add 6 special education paraprofessionals, 1 early childhood teacher, and 1 cross-categorical MS teacher.
So
Second.
First and a second. All those in favor?
Aye.
Aye. Opposed? Abstention? Motion carries. Thank you.
Thank you.
Happy hire.
Yeah.
We're trying.
Yeah.
All right, next item on the agenda, 127 plan document and procedure.
Okay.
Yep.
So this past December, you all heard from me with regard to our strategic plan strand related to the people portion of our strategic plan document. In that, we had a lot of conversation about equity, the percentage of staff compared to the percentage of students. We talked about a Grow Your Own program that I ultimately would like to see us get implemented and funded so that we can use support staff in our own district that want to become teachers and help support them in those efforts, because many of them don't have the ability to be working, go back to school, fund their schooling, because they're just not making enough to be able to handle that and their living expenses, etc. The first step in that process is for the board to adopt this Section 127 plan document. It's a formal plan document. It's drafted off a template from one of the legal firms. It's got a couple of request forms and approval forms that would go hand in hand with it. Essentially, it's a little over 5 pages that, when you boil it all down, gives us the ability to support tuition reimbursement for support staff that are seeking teaching licensure within an approval process. Like, there's another plan that'll wrap around this, but this is the base of it. It allows them to receive a little over $5,000 according to the IRS tax-free in reimbursements. If we don't have this plan in place, then there are tax consequences to anything that we would do from a reimbursement standpoint. In the plan document, you may have noticed that I capped it at $5,000 per calendar year. As I said, the IRS amount is like $5,225 or something to that effect. 5,000 is just a whole lot easier to manage and for people to remember. And so in the plan document, I chose to leave it at that $5,000 flat amount. We do have planning for some financial support within the budget structure. We're trying to get it through Esser, thinking about how we can approach that in terms of getting staff fully qualified versus our one-year licenses with stipulations. This would get us towards those efforts. I am not sure yet if DPI is going to approve that as an appropriate request within Esser. To the effect that they don't, we have some other plans for how we can shift some other funding around to be able to provide some support. And then we'll have to keep evaluating once we have that in place as to whether or not it's meeting and achieving our goals. If it's not, we'll have to go another direction. If it is, we hope to be able to add to and build the program over time. So I'm asking for the board to move approval and adopt the plan document with its connected forms tonight, which will get us into that beginning planning process, and then we can start putting our Grow Your Own program structure around this and start marketing it to our support staff and get some people on board. And I'm available for any other questions you may have.
How much was it originally? You said 5,000 here, but you just rounded it down.
The IRS amount says $5,200 and some dollars. I think it's $225 or $250 in the IRS regs, and they adjust that on a, I don't know, they haven't adjusted it in quite a while. But periodically they will go in and adjust that. I'll keep monitoring that. To the extent that it adjusts, I may come back here and ask you to modify the plan document to raise that dollar amount. Part of that just depends on funding.
Yeah, because I'm just thinking, you know, if the IRS is allowing $5,225, like you said, we should just take advantage of the whole entire amount.
The IRS isn't providing the money. We provide the money out of our budget. There's no funding source for this other than ourselves.
Gotcha.
We're investing in our staff so that they can obtain licensure. Our goal would be twofold. We would like to see more staff licensed in areas where we have a strong need. Special education is a great example. ESL and bilingual teachers, great example. So to the extent that we can get some of our staff members certified in those very hard to fill areas, that's one focus of what our Grow Your Own program would be all about. The second focus, quite frankly, is on growing our staff members of color and being able to provide teachers in demographics that match our student demographics. Right now, our staff demographics, as you saw in December, do not match up with our student demographics. And I would like us to see progress towards closing that so that our staff demographics are more representative of our student demographics in this district. It's a goal that almost every district across the country probably has, and a goal that none of us are really meeting. So if we don't take at least some efforts, we can't even make forward progress. So,
having done this in 2 districts before coming here, the question I have, you know, we can help them financially, but I always had a stipulation how many years they then owed us for doing that.
That's
I'm
in the
sure
plan
you
document.
have that in there. Correct?
Yep, it's in the plan document. For every year that they receive funding through the Section 127 plan, they would have 1 year of service required post certification. So if they receive funding for 2 years because they're able to get their licensure within an 18-month period, which is not uncommon if somebody has a bachelor's degree, then they would have to work for 2 additional years in the school district following that licensure being issued. So it's tied kind of a 1-to-1 ratio.
Now, if they were to leave in a year and they owed us 2, would they pay us back then?
They would pay us back 50%. That's what's built into both the plan document as well as the request forms. Obviously, there's always a challenge of being able to recover that money.
Sure.
So, you know, that's a risk. It's the same risk we face when we're doing breach of contract fees for our staff who are resigning. But overall, because we approach it pretty open with people, I haven't had too many past experiences where we haven't been able to recover that.
It's worth the risk.
I think it's more than worth the risk that we would take.
Is there a cap, like 5 people can do this a year, or because
based on our budget?
Okay.
Yeah, based on our budget. And right now, our target is to try to have about 25,000 available, which would, in essence, fund up to 5 staff members. The catch is I probably want to start a little bit smaller than that because we need to make sure that we can support them potentially for a 4-year program if they don't have a bachelor's degree already. We are also partnering with the UW system for some of those connections. And so in addition to working with CSA 9 and some other alternative venues for getting licensure. So.
Do they have to be employed here a certain amount of time before we consider them one of our own that we're growing?
They wouldn't necessarily. That isn't built in really to the plan document, but I do think as we're evaluating, there'll be an application process that staff would have to fill out to say, I would like to be part of the program. That's the part I have to build to wrap around. So there'll be an application they need to fill out, probably an essay question or maybe a couple of them that they'll fill out, and then we'll do a screening process to select. I do think some of those factors will come into our vetting process as we process them.
You know, going back to Ka's point about the dollar amount, and I'm just thinking this may be more efficient long term, could we say that reimbursement conditions can obtain up to the IRS reimbursable limit, currently 5,000 whatever, so as that goes up in the future you don't have to come back to us to amend the plan document?
We probably could, because that dollar amount is set by the IRS. So we could just take out that dollar amount and say up to the IRS established limit for 127.
And then put currently $5,255, and then you guys can change that as needed as the limit goes up.
Yeah. Yep. We certainly could do that. That would probably take an amendment, like, but you can handle that.
I think we can do a friendly amendment.
Yeah.
On that.
Yeah. For sure.
Okay. Any other questions?
But then, if you're going to have 25,000 set aside, then we can only send 4 instead of 5.
And they may not all take 5,
right?
Depending on the credits they need.
Having the up to language is valuable because some will cost more than others depending upon the program that they need to find. Some will take 4 years, some will take 1. Some may already be partway through a program and they just need help with a couple of last classes. So the amount of financing available for each person is going to be very individual.
Right, and if everybody went up to the max for 5 people, that would, what's our exposure? $1,100.
Right.
So Keith can pay that out of his pocket.
There you go.
Is there anything similar to this that you can do for our graduates? I mean, when I think of Grow Your Own, I think of a student who grew up in Wausau, graduated from our schools, that maybe would have an interest in staying here for the rest of their life, as opposed to somebody who moved here a year ago and may not be here 3 years from now.
Yeah, and I think that actually is an ideal concept for our foundation to probably look at in terms of providing scholarship opportunities specific to the guidelines and the ideals that we're looking for with the Grow Your Own. We could look at it within the district also in terms of providing a scholarship, but I do think that gets a little sticky, and I think it's a little clearer if the foundation does that. I would be more than happy to work with the foundation to talk with them about how we might be able to get that effort going and use some of the same context for that. I also think it would be an easy way. I think there'd be a lot of community members and business owners who might get behind that to help support that effort as well. So I think the repayment piece is harder when you're giving it as a scholarship for students coming out of high school. For staff, they're already employed in getting a paycheck. So I think the structure ends up being slightly different, but the concept, absolutely.
Okay.
One of the things that I learned in one of the CISA meetings was one of the schools in the area has actually got curriculum in the senior year to help prepare kids who wanted to go into education, and I think that would be a great addition.
Dr. Rauscher and I actually have been having some of those conversations with our high schools to look at some of the programming options from the standpoint of classes themselves, experiences as well, and kind of on a third level, some extracurricular kind of opportunities that we could offer for those that are interested in a teaching career. So those things are in our conversation wheelhouse already, and you may see those coming down the pipe in the not too distant future.
I'd like to see this done for all public service jobs. We talk about college and business and this. Most teachers, a lot of teachers it's a family business basically. My mom taught, my grandma taught. Police departments, my dad was a cop, my sister was a cop. And I would like to see us talk to our kids more, because those are jobs that are here, that they could stay here for, instead of just letting the families keep feeding. Get some new blood and things.
All right.
I was just going to comment 2 things. One, to speak to all kind of career opportunities. Hopefully you'll continue to hear more from us about the academic and career programming that we offer to all students starting early middle school and progressing all the way through graduation. So that's a great way to help kids find out what they might be excited about, what the options are, what their pathways could be. And then also, as Mrs. Gunder pointed out, we're looking to what we can do more of in terms of preparing future educators. But just a couple things I would point to that happen now in some of our high schools, for example, would be some of the leadership-based classes and some of the opportunities where students have to work as teacher assistants. And typically where that happens is a student has an interest or a talent in an area, maybe just a general excitement about that specific area or about teaching and says, you know, to an instructor, hey, can I work with you as a TA during what would otherwise be a free period in their schedule? And they have the option to not only do that, but to earn some elective credit. So good things happening now, and more things that we want to do.
All right. I am seeking a motion to approve the Section 127 plan and supporting forms as presented with the friendly verbiage amendment of up to the IRS limit.
So moved.
Second.
First and a second. All those in favor?
Aye.
Opposed? Motion carries. Thank you.
Thank you very much.
All right. Ms. Lloyd, item F, animals on district property.
Hi again.
Seems like we just talked about
Right, you'll see me again before the night is over. So this one is really quick. We had determined last year that we weren't going to do a therapy dog policy, and then there was some interest around it. We ended up doing a therapy dog policy. So in this policy, oops, sorry, it's not up there. Animals on district property, it addressed therapy dogs in there, and it contradicted what we had in our new therapy dog policy. So we struck this, and then that eliminated any confusion, and we just have it in our therapy dog policy.
Okay.
There's a separate policy for therapy dogs.
Separate policy. It's 8390.01.
Okay.
Yes.
Does anyone enforce the prohibition on dogs being in the areas where there are students and staff? Because I see them all the time. Sidewalk, picking up kids from schools. They're not. They're around.
You can't keep them off public sidewalk.
No, I mean right in front of schools, picking up kids and stuff.
That's the first I heard of that.
Yeah.
I don't know.
That's the first thing.
Dog patrol.
There you go.
I used to pick my kids up, and there'd be a lot of people there with their dogs picking their kids up.
That's common.
All right. If no more questions, seeking a motion to approve the recommended changes to policy 8390 as presented.
So moved.
Second.
First and a second. All those in favor? Aye. Opposed? Motion carries. Thank you.
Thank you.
Item G, Dr. Rauscher will present the activities code of conduct for Wausau East and Wausau West.
Hello, everybody. As you see on the agenda, there are two different codes, or it appears there are two different codes attached for you, but really we have one activity code, one that has the Wausau West logo on it, and one that has the Wausau East logo on it. If you had a chance to take a look at those and you've been on the board before, you would probably think these look the same as they have in the past, and that is correct. So you will not see significant changes. These are just little updates of contact information, those things being accurate. So I would ask that you hopefully continue to support those. If you have questions, please let me know.
All right. Hearing none, seeking a motion to approve the activities code of conduct as presented.
So moved.
Second.
We have a first and a second. All those in favor?
Aye.
Opposed? Motion carries. Thank you.
Thank you.
And you win the award for the shortest item tonight.
There you go. Just bring us something that doesn't change anything.
All right. Community leader listening and visioning. Dr. Hill.
I just wanted to update you on a few things. So first had a meeting over a couple of mornings with representatives from these groups here. A number of these partners we work with pretty closely. Purpose of the meeting was to just kind of give them an update on the district, kind of state of the district, if you will. Talk about some of our needs, some of their needs, and see if there are opportunities for collaboration. Just kind of tap into some of their thinking. So if you want to go to the next slide, Cassie. So first we just reminded them of our strategic plan, kind of the process that we use to develop it, the listening sessions, whatnot. Reminded them, and actually this isn't a bad reminder for the board, right? This has been 3 years now. There are really two main areas of interest in those listening sessions. One was related to staff, the others related to supporting students, and you can see the list here. And then from here, the next one, we developed our strategic plan. Lots of measurable goals. You heard about 3 of them tonight from Mrs. White. So real quickly, just very high level, what have we actually accomplished in the strategic plan? So The teacher compensation model is currently in transition. That was a big one. I'm going to have to go down here because I can't read that far. Oh yes. Again, full pupil services teams. A lot of gratitude to the community for passing referendum question number 1. That was Mr. Tess's main goal. So I don't know what you're going to do. No, but we're really grateful to be able to offer full pupil service teams at each school this coming year. Those bridge rooms, which include the behavior interventionist. I'll talk about those a little bit more. Leader in Me addresses a number of those strategic areas of interest. And also through Mr. Tess's strand, we will do some budget efficiencies and create that student safety specialist position 2 years ago. So there was some high-level accomplishments associated with the strategic plan. Then we talked about, lots of great things going on. We also have some needs. So we talked, this has been coming up, and certainly the situation with Wausau East football just kind of highlighted it again. We've got some concerns about equity across the river at the high schools. So if you go to the next one, these are just a lot of people didn't realize we had 2 high schools. I don't know if you remember that from the community survey 2 years ago. 23% of people didn't know we had 2 high schools. So, and then those who do, a lot of times they think that Wausau East and Wausau West are identical. That if you go to one, it doesn't really matter, but you can see just based on enrollment, significant difference. Difference of about 800 students in secondary enrollment. This is middle and high school, which is the average size of an entire high school in this state. So it's a significant difference. That just leads to concerns on our part. If you go down, the next, access to college credit-bearing classes, whether it's dual enrollment or Start College Now. If you go to the next slide, inequitable access to some of our programming, east to west. And by the way, students can cross the river and they just don't for a number of reasons. But so those were some of the concerns we shared. And the next slide, we just talked about our facilities, and so it was interesting to talk to these folks because they have similar situations, but. We have it's about $1 million a year in our capital projects, and to do the roof at Riverview is $1 million. So our entire capital project budget was eaten up with one project, and so we shared that situation, and then of course we have 20 buildings. So we just talked about we want to do preventative maintenance. We've got lighting and interior finishes and storage, and there's another slide I think around lighting. I thought Mr. Creasher might appreciate this. I don't know what year that's from. That's 1908, I think. I don't even know what school that is, but it keeps running, and our maintenance folks do a great job of keeping this stuff running, but it's not efficient, and so we talked about some of those things. Obviously, then air conditioning at the different schools, technology updates. So we shared. We had that conversation as well. And then we had some conversations about, what are our shared opportunities? What are our shared interests? So we talked about, are there spaces we can share, for instance? That got a lot of interest. Playgrounds, and we talked about our interest in maybe some more spaces that the community could use, or community providers could come and use. Because right now we have to clear out the library for people to do dental work or whatnot. And so we had that conversation. One of the challenges, of course, is if we're transporting students, any efficiencies are lost because of the cost and the time that's lost due to that. So we talked about those. Then we talked about there's new things we want to do as well. We need those pupil services spaces now that we have the staff. We have one of the last 3 years in the staff engagement survey when we've asked them, what are some of the main things we can do to improve our educational quality? Hands-on learning, right? And some of those innovative opportunities. So a makerspace might be an opportunity. Again, those community rooms, that school forest, the environmental center, we've got a number of spaces that we're interested in. So if you go to the next few slides, and I can talk about any of these in more detail, but just kind of let people know, when you talk maker spaces, it looks something like that, right? Individual work, small group work. Teachers are really excited about these opportunities. Could be tech, could be fine arts, could be whatever. The next slide, the bridge room. Just remember what bridge is an acronym. It's not a punishment room. It's a place where kids can go and develop skills. The next one, we've talked about the Environmental Learning Center and our interest in that. And so I guess tonight I just really want you to know that we had a very healthy conversation, no real concrete plans moving forward, but we did decide we are going to meet on a regular basis because we found value in it. So I guess just kind of let the board know, obviously we've had a couple of referenda. I felt like, we needed to kind of reset. We've got, we're in a different position than we were a year and two ago. And so with these needs, I just wonder, what would the school board like us to do, with these needs? What's the interest? I guess I'll leave it at that for a second. I've got some thoughts, but just...
I know that a few months ago, when we were talking about pandemic funding for HVAC updates, and I suggested that, those pandemic funding that would possibly qualify for HVAC updates, right? Like the air going in, going out, not circulating. Would those pandemic funds, that would qualify for HVAC updates, wouldn't it?
Most likely, if we were in need of any of those, we did a lot of them already through energy efficiency exemption over the last 4 years. Okay. Most of the things on the referendum were not HVAC upgrades. AC as an example would not be pandemic funded.
Oh, okay.
Adding AC, it'd be a big stretch.
Does help us with the MERV 13 filters versus the 11.
We're doing some of that already.
Yeah.
Yeah. Okay. Just wondering about that.
Yeah.
So, I think, at least in my head, that does a great job of really encapsulating all the discussions that we've had in the last 3 years, even through 2 failed referendums. And I know that there was, and I heard it from a lot of folks. I'm on this board, right? They say, the last one only failed by 75 votes or whatever it is. I would rather, well, I don't want to go there, but if it passed by 76 votes, I don't know that I would have felt good about that.
Right.
Just because it's so, so polarizing. And to me, it should be a very easy, compelling story to tell, because there are very well documented needs. And I think if we can clearly separate those from the wants, that we can have an efficient discussion with community leaders, with parents, with taxpayers, and really lay out, here is that strategic district plan. I don't want to say it's just facilities, because it's probably bigger than that. But would that be something that administration could entertain, is to go formulate a plan in terms of, again, just really coalescing what you have here, but into something that would be more action?
Yes. I think what you pointed out is important. We don't really want to pass a referendum by just a few votes. We really want the community to understand. So clearly the solutions that we presented in the last couple, they did not resonate. I think we have a unique opportunity now, or I should say a renewed opportunity to engage with the community. If the board is interested in that, we could develop a community and a staff engagement plan, bring that back to you, let you know what it is. It sounds to me too like you might have some interest in being a part of that over the, and so we could develop a proposal, bring that back in 2 weeks, and see what you think. That's kind of where my head was going, because again, if we separate needs from wants, what I was referring to a few meetings ago when I said, the board could get behind something and engage with community leaders. To me, that may be a better topic for a want than not necessarily, if it's a sports facility. I know that's a bad example, but that's the only example we've really been talking about. Yeah. Maybe it's not a bad example, but that's more of a want, and I think people would recognize that. It would be incumbent on us to demonstrate the value of that want, which I quite frankly think we can do. So if we can
clearly separate those two, to me, this has a lot of legs.
I think that, you know, we have this conflict where we have people who tell us they want us to keep all these small neighborhood schools, who also tell us they want our taxes to go down and wonder why ours are more expensive than the school districts that don't have small neighborhood schools. Like, they vote against the referendum that supports the small neighborhood schools, but also vote against us if we try to close and get more efficient. So there's obviously an educational component there that needs to happen. Like how you had the slide up there about our 18 or 20 buildings, I bet you most people don't know that. You know, if 23% didn't even realize we have 2 high schools, how many probably don't realize we have 13 elementary schools that we have to take care of, and have to have an administrator every one of them, and, you know, traveling staff, and they don't. And so if the community really wants to support those, if that's where the community's at, then I think we've got to do a good job explaining that's more expensive.
Mm-hmm.
And so
I think
support
it has been well explained. I mean, you can lead a horse to water, but you can't make him drink. I mean, we have explained.
Yeah, but the people that vote in the next election aren't the same people that voted, you know, 5 years ago. It's community
And
changes.
we're not, this is an assumption, but we're not going to tie any school closures to another referendum. We learned, right? We learned quite a bit, I think, going down that path. It just, you're right. That's
creates
the core,
a vote.
right? And that's the core of the communities, the neighborhood schools. So going in, assuming we're going to keep those, here's what it takes to maintain them.
It's highly emotional, some of these issues are, like the east-west piece. Then when we start looking at these kinds of graphs and this kinds of data, it just highlights again and again something Jane has been saying since the first day I was on the board, that we really need to take a look at this.
Don't we have to have a broader discussion about that, though? We have, like you said, 13 elementary schools, some of them aging. You know, the costs associated with that. Some you can draw a 1.5, 2 mile radius and hit 3 schools. You know, you're talking some of the referendum, you're trying to split it up between a bunch of buildings and do little bits here and there where we can upgrade and do some things, versus if we actually sat down and talked about honest potential consolidation and creating a state-of-the-art school for our students that is up to date on HVAC and all the, you know, all the preventative maintenance obviously goes, you know, a little bit down, obviously, from compared to an aging building.
Mm-hmm.
You know, these are real conversations that I think need to take place and to happen, and we got to be honest with ourselves about what the future of the district looks like. You're talking about East and only having 800 students, and how many students was that facility designed for?
Mm-hmm.
I just think I know it's a tough conversation, but it's one that has to be had.
Mm-hmm.
I mean, we tried, you know, 2 referendums ago, that was the conversation. It was combining Lincoln and Grant into one new state-of-the-art school. Take 2 schools that are old and 2 schools that we think are lacking in facilities, and create one new, and it created no vote. You know, even though the result was a new school, it still created a no vote. And when you have a no vote contingency, you don't pass a referendum.
Yeah, I think you know, and the board doesn't have to create the solution. I think everything you're saying is accurate. I think we have to come to the community and the staff and say, what is our solution that you know will get behind? I agree, and it could be a pretty deep conversation. You know, if we can get people to engage, right? And that's where I think I'd like to come back with a plan for you to say, this is how we think we could engage in multiple facets.
Are people comfortable? I'm sorry, go ahead.
I was just going to say, people haven't really changed that much. 50 years ago, when Lincoln, which I still call the new Lincoln because I went to the old Lincoln, Lincoln School in Wausau West opened up, the deal was, you know, we're going to pass this and build this new high school, and then when that's paid off, we'll build a new East. Well, that didn't happen. The agreements weren't kept, and it took 30 years to build Wausau East. And to pass a referendum where you're only working on this building and this building is a tough go. People want to know that they're getting something in the mix too. And you know, the last referendum, there weren't really a lot of wants. It was, these buildings are aging, they need work. And it's just, I just don't know how to do better messaging.
Well, we didn't have a very good opportunity to do messaging because of COVID, though.
That's
so
true.
They might have been perceived as wants and not needs.
board members comfortable with giving just that direction to administration, as you would outline, to come back in a few weeks with more of a cohesive plan in terms of how you want to proceed?
Yeah, an engagement plan with the community and staff.
Yeah.
Absolutely.
Can I get some clarification though on slide 10 here with the dual credit students between West and East?
Yeah.
So that's 434 students at West and 166 at East that are dual credit students?
Yes.
Okay. And then the number, the dollar sign, that's how much those dual credits are worth.
If the students had to pay for those, yeah.
Oh, okay. And so the Start College Now students, so 49 of them that are dual credit, they become Start College Now students?
No, those are two options. Is Jennifer?
Okay.
There you are.
Yeah, yeah. I had to move so I could, sorry.
Oh, okay, yeah.
See it better. I lost my
I know Jennifer was
laptop
just
charge.
here.
Yeah, the two different programs. So dual credit, those are the courses where students take a course in our high school with our high school teachers, and they also earn post-secondary credit at the same time. So these examples are through NTC. So let's say a student were taking a personal finance class with us at East or West, and then they were also earning NTC credit at the same time. That's dual credit. Start College Now is our students who would actually go to NTC or take an NTC class online from an NTC instructor. So they're two different programs. And it's just, the reason we had included this is you can see there are different things happening at the different high schools. If you look at dual credit, the classes students take at our high school but earn college credit for, that happens a lot at West, not as much at East. Start College Now, where students go to NTC or take the class online through their instructors, happens a lot at East, not so much at West. So those are things that we were trying to make sense of, and why do we have those differences. And I don't have dollar amounts for Start College Now, but that's something that we probably could get in the future if that
because
or something the board are interested in.
Yeah, because I was looking at the numbers too, and I'm like, it's so weird that there's 434 versus 166, but then 10 only at West take advantage of that at the Tech, and 49 from East. So like, where are the 300 other students at West? Where are they going? Are they going to like UW schools or?
No, that 434 and the 10 are different. So that's actually representative 444 students.
Right. But it's okay, so that 10 is not coming from that 434.
No.
Totally different programs.
Right, and you're not adding in any of the AP kids, full AP
Correct.
or full IB or anything like
Or
that.
or the early college credit, which is the University of Wisconsin partnership. So this is purely some sample data just on our NTC partnerships. Three different programs: dual credit, Start College Now, and then Youth Apprenticeship.
Just an example of how East and West are different.
Yeah.
Right.
Yeah. Yep.
Okay.
One of many examples.
One of many.
All right. I don't think there's any action that's needed on that. You
I
guys
think
good?
we have direction.
Okay. All right.
Good. Thank you.
Thank you. Okay. Next item, our school resource officer.
Oh, and we're going to. Were you going to speak to it?
Oh, you?
Okay.
I promised them they'd see me one more time.
Oh, okay, that's right.
There we go. I'll follow through. So our SRO MOU is due this summer. It was in the hands of the city attorney for about the last 2 months. We got it back at the very end of the week last week, and there were some changes that we needed to send on to our insurance company. So it is not prepared for tonight. It'll be prepared for that in a month.
Yep.
Okay. Thank you.
Thank you. Okay, open forum. First item, board member professional growth and development report.
I attended the Hmong the Hmong Festival last weekend. It was fabulous. I'd like to see more people there. I've been there each of the 4 years that they've had it, and it gets better every year. I don't know how, but it does. It's just extremely interesting. Lots of politicians show up that you get to talk to. It's just a good place to meet and greet and learn new things.
And I attended the annual convention for CISA 9, which was just absolutely incredible data and statistics. And we've referenced a number of programs tonight where CISA 9 is directly impacting the school district. One of the major ones that I think is really significant is the fact that they also are representing and working with superintendents from throughout the CISA 9 district. So there's lots of opportunities for communication and understanding what's happening in other districts. I was just absolutely very impressed with this program and would encourage everyone to get familiar with it.
Thank you. Anything else?
So yesterday, I was invited to St. Paul to celebrate Sunisa Lee, our new Hmong gymnastic gold medal winner. So I got to, attend the program, and it was all very uplifting, very inspiring, for the Hmong community, the greater Hmong community, and for our students too. Seeing that, someone from the Midwest, can, rise up from very, very poor beginnings and become an international, inspiration for our kids.
God, how old is she?
She's 18.
18. How they walk on that beam still blows my mind.
Practice.
Yeah.
My daughter was a national finalist, and every time she got on that beam, I was scared to death.
I watch it every time it's on just because I'm amazed. I couldn't walk across it, much less
scared me.
go all there. Yeah. Okay. Anyone else? Okay. All right. Moving on. Ms. Lowe, Legislative Liaison update, please.
Well, I don't have any. I mean, there was a lot of legislative goings-ons, but not anything that was specific to education, unfortunately. So
Okay.
I don't have anything.
All right. Thank you. Superintendent commentary, Dr. Hiltz.
Nothing to add tonight.
Nothing to add. Presiding officer commentary. We'll reference the board member liaison district activity report be entered into the official record. I do not have anything else to comment on this evening either. So with that, we'll move on to the next item, which is a request for closed session pursuant to state statutes. I will seek a motion to enter into closed session to discuss pursuant to section 19.851C Wisconsin statutes to consider employment, promotion, compensation, or performance evaluation data of any public employee over which the governmental body has jurisdiction or exercises responsibility, specifically to discuss the resignation of a member of the teaching staff. This is a roll call vote. Yeah, you.
So moved.
Second.
We have our first and second.
It's okay. I was reading. Just forgive me. Jim Boucher.
Yes.
John Kreischer.
Yes.
Kyle Lowe.
Yes.
Cody Nicolai.
Yes.
Jane Roosh.
Yes.
Lance Trollope.
Yes.
Karen Vandenberg.
Yes.
Lee Webster.
Yes.
Pat McKee.
Yes.
Thank you.
All right, we will reconvene in open session if necessary.
And that'll be in the PDC.
Yeah, that's right. We don't see you. Thank you, everybody. Have a good rest of your evening.
Tabitha, are they going to be coming back here if they have a motion
If they,
for?
I can do an interview.
I don't know that they need to.
Okay. I just wanted to know for.
If you want to do it.
Yeah, I mean, they will need to do a motion, but I guess I wonder if they need to come back here for that
Yeah, that's what I
necessarily.
No.
Do they have to?
Okay.
No, because I introduced myself. It's not. Oh, wait, you caught me as a. No.
You should be receiving enough copies of this for the.
Keith,
I got the one.
they need to come back here to make the official motion.
Um,